A San Antonio company has developed a remarkable medical device about the size of your smartphone that can oxygenate wounds and ultimately heal chronic wounds, in many cases eliminating the need for amputation. Let's head out to EO2 Concepts and learn more.
The problem with chronic wound care is you've got a lot of people that have compromised health, either as a result of age or diabetes. And diabetes is a growing problem. Actually, both are, since we're an aging population. And you get a lot of people that these wounds that don't heal under normal circumstances. So, for example, if you're going out and you get a bandage or something else, you can put that on and you heal. The ones we're talking about are chronic wounds that don't heal more than about 50%, so i.e. the wound size goes down by 50%, half in 1 month, and then they're deemed to be chronic wounds that need advanced wound care. So we're in the advanced wound care space. The name of the device is called EO2. It stands for transcutaneous oxygen going to the wound bed. And so what the device does is it actually pulls oxygen from the air and converts it into water and then directly back into pure oxygen, and that goes to the wound bed. So you're actually getting oxygen delivered to the wound bed, similar to the way you breathe now, or you use an oxygen tank or a respirator. We're doing the same thing for wounds. All solid state, very quiet and very lightweight. So this is the EO2 device, or what's also called the EO2 device because of our logo. What this device does is it actually brings in oxygen from the surrounding air into the device, and then there's a fuel cell inside the device that converts the oxygen to water, and then pure oxygen will come out this small port here and goes to the patient. And how we do that is we connect an oxygen cannula up, simply a lower lock, like you see in hospitals. You just twist it on, and now oxygen is flowing out this cannula, and it goes to a dressing. So what this dressing does is then the oxygen will come in through this port, comes into the dressing, and then what we have inside of this, and we can show that later, is a small spur. And what this spur does, we have a patent pending on this, oxygen comes in, it gets dispersed across the dressing, and then it comes out through the dressing onto the wound. So you place it like this, and you get an even distribution of oxygen throughout everywhere.
A key component of the EO2 device is this small oxygen fuel cell that utilizes NASA technology.
How this works is that oxygen will come in through this filter here. It then comes inside the fuel cell, gets converted to water. Then there's another catalyst here where it can convert back to pure oxygen, and then it flows out through this port and then comes out the tubing to the body.
Dr. Niederauer reports that in most cases, the use of the device results in dramatic improvements in chronic wound closing and healing, often eliminating the need for amputations in extreme cases.
We're seeing this in all kinds of wounds, including diabetic foot ulcers, which are ulcers of the foot below the ankle typically. And that's where you have, from diabetes, what you get is a constriction of blood flow, and that causes the wound to become ischemic, or what also means that there's not enough blood going to the wound. And so we treat those. We also treat what's called a venous stasis ulcer, which is the lower leg, where you get a large leg edema, which is a buildup of fluids, and the skin starts breaking down. We're able to treat those. We've also done pressure ulcers, so what people call bed sores. People that are bed-bound or wheelchair-bound, and then also surgical wounds, and we're getting to more acute wounds now, which means wounds that you get surgically induced or trauma, things like that, things that are very recent versus chronic, something that's ongoing a long term. So the difference will be, for example, if you're using just a normal dressing, what happens then when you put a dressing over a wound, and you can see here, most of these dressings, just like, for example, if you go to a local pharmacy store, you can buy a waterproof bandage. That's very similar to what this is. So it's got an occlusive layer on top, a foam inside, and when you put that on your skin, you now have protected the environment. So you're keeping bioburden, bacteria, dirt from getting into the wound, but you're also keeping oxygen from getting the wound. For you and I, that's not a problem, but somebody that has a chronic wound that doesn't have a good blood supply, they've now got an area where the oxygen is compromised getting in from the body. You've now blocked the oxygen source on the outside. So the oxygen side is now starving. So it's just like trying to breathe in a bag for a little while. You start running out of oxygen, you feel it very quickly. Same thing happens in the wound bed. So if you don't have any oxygen from below, that wound can actually get worse and necrose or die. By providing oxygen, now we provide basically oxygen to allow it to breathe again. So you can either say we're supplementing oxygen in to make it work better, or another way of saying is we're removing that oxygen barrier. So there's a barrier, if you don't have enough oxygen, there's a barrier to healing by not having enough. We're supplying that, so now we've removed that barrier. And what's interesting, if you look at the scientific justification by oxygen being in wound healing, what we normally experience as oxygen is sufficient and works very well for everything we do in wound healing, fighting infection, getting new capillaries to grow, new tissue to grow. But what's been shown is if you actually can increase that oxygen above what's normally there, you actually get more effect. You get faster and better repair.
Tell me a little bit about the cost to healthcare providers to use this technology.
So with this system, what we can do is we can actually treat wounds and bring them to full closure at a fraction of the cost of other technologies. We are currently the lowest cost technology to bring a wound to full closure on the market. So what we're doing with this therapy, we have a novel new technology that enables patients to have a better quality of life. It's something they can carry with them. The therapy is always on, and we've seen it enable pain relief in patients, used on multiple types of wounds. And what we believe we can do with this, we can change the course of a lot of healthcare by enabling something that's very easy for the patients to take care of themselves with. They can apply their own dressings. They can wear it all the way until the wound closes, which is fairly unique in advanced wound care space. And we can do this at what we've seen in clinical results in a fraction of the time of other therapies and also a fraction of the cost of other therapies. So not only are we making quality of life better for patients and getting them back to their normal operating quality of life again, being able to be mobile and working and productive members of society or happy members of society, but also we're saving the system money by reducing the time to get these patients out of the healthcare system and back to normal life and reducing the cost to do so and getting there.